So just to give you a little snapshot of the role of physical activity, we say that, and evidence suggests again and again, that exercise is effective across the cancer trajectory, if we would call it that. So if we're talking for someone who pre-diagnosis or the prevention of cancer, we know that physical activity plays a role in the prevention of some cancers, and I have a slide coming up to show you which ones. We also talk about if individuals are physically active before a diagnosis with cancer or during that pre-diagnosis but before surgery period, that it can help with the surgery and treatment-related elements that come with that. So it's sort of in this prehabilitation realm. We also know that during treatment, physical activity, the primary role of physical activity is really in terms of physical functioning. So if it can help, and we often hear anecdotally stories from individuals telling us that by being physically active during treatment, it helps them just do the day-to-day activities. So getting up off the couch, for example, the things that were really challenging for them become a little bit easier, and that helps with overall physical functioning and quality of life throughout the treatment period. In the early post-treatment period, we say that physical activity predominantly highlights or has a role to play in quality of life. So physical activity helps improve all aspects of quality of life, from physical health, emotional health, social well-being, spirituality. There's a role that physical activity plays in all of this to help improve quality of life in this early post-treatment phase. And then long-term, we're really talking about the reduced comorbidities, an impact of physical activity on reduced mortality rates in some cancers, for both all-cause mortality as well as cancer-specific mortality. So important role for physical activity in this area as well. And then in end of life, from a patient's perspective, we tend to focus on physical activity from predominantly from coping, from managing life, the day-to-day. And we also have done some interventions with caregivers to look at the role that physical activity can play in helping the caregivers improve their physical and mental health through this period as well. So as you can see from all of this, the role of physical activity is quite diverse, but always towards focusing on improving life for individuals diagnosed with cancer.